And we are back with more on News Talk Saga 960. So very glad you could join us to start your work week right here on the Mark Petrone Show. Well, imagine not being able to get an organ transplant that could, potentially save your life. A desperately needed organ transplant, and you can't get it. Why? Because you have declined to get the COVID vaccination. That's right. Well, this is actually going on. Fortunately, there is the premier in Alberta because this incident took place in that province. And Danielle Smith has come out and said, well, you know what? We need a second legal opinion in the case of this transplant patient who refused the COVID vaccination. This is an absolute outrage. And yet, the Alberta Court, the Court of Appeal, has come out and said, no, you got to get the shot. Premier Danielle Smith saying that she's seeking a second medical opinion in the case of an Alberta woman who refused the COVID-19 vaccination as a precondition for a major organ transplant. Now, bear in mind, there are certain parts of this case that we can't talk about, we can't divulge. And Sheila, who is the patient in this case, says that she'll talk about this as much as she possibly can. This is something that needs to get out there. And this move, according to one health policy expert, says it's likely without precedent. So that means that it could be precedent setting, right? In the future. Is this what we really want out there? Sheila Annette Lewis is the lady. She is a terminally ill transplant patient and has twice lost COVID bids, or court bids rather, to be reinstated to the top of an Alberta Health Services transplant list. This is an absolute outrage. I want to bring in Andy Lee, who's been looking into this matter. Before we bring in Sheila, Andy Lee has been following the story carefully. She has been speaking with the patient in this case, Sheila Annette Lewis. And Andy, this is one of those cases that really makes you wonder about what's going in the mentality, what's going on in the minds of some of these judges.
Yeah, so very, very unfortunate story. And, even more unfortunate is that she's not alone in this. This is happening. So, she's been denied a life-saving organ transplant, unfortunately. Twice now, she lost her appeal. The JCCF was representing her. And, they decided to uphold that decision, unfortunately, which will mean that she will die waiting for an organ transplant because she didn't get vaccinated. I think, there are limits on, what transplant patients are allowed to do. Like if you are an alcoholic, you have to get your alcoholism under control before you receive a liver transplant. And there's some basis for that, obviously, because, organ donations are precious. So we don't want somebody who receives an organ to, go on to destroy that organ. So those limits have always existed. But this is a little bit of a different gray area because there's no guarantee that if she gets a COVID vaccine, that will protect her organ in the future. Because we know that she can still get COVID. And her outcomes might be a little bit different whether or not she receives the vaccine. But there's no indication that because she receives the vaccine, that's going to give her absolute protection for her organ in the future. So it's a little bit different. It's a little bit of gray area. Good to see Danielle Smith pursuing this. And I hope that she's going to continue to pursue it because, like I said, this is a little bit of an unprecedented situation. She's taken this under her wing. She's seeking medical opinions. And yeah, this could end up setting a precedent because this is kind of the slippery slope that we're on. Is that, are we going to further limit people based on, their personal medical decisions and things like that and their personal health decisions as to whether they can receive organs in the future, right? Like, where's the limit here? Are we going to start saying, we won't give you a transplant unless you, lose 20 pounds, right? Because your outcomes are better, right? It's kind of like, where do we draw the line here, on being compassionate and things like that and providing people healthcare. So anyways, Sheila's fighting this battle. She's been fighting it for a while. She's going to continue fighting it. So, let's bring her in and see what she has to say.
Sheila Annette Lewis joining us from Alberta. Welcome, Sheila. Appreciate you coming on.
Thank you for having me on today.
All right. Well, this is just astonishing that this would happen. And we've seen some tweets by doctors like Stephen Phillips, for instance, Dr. Stephen Phillips. He says, I think it's fair to say that refusing to provide an organ transplant to unvaccinated patients is an ethical crime. And it's just absolutely outrageous that doctors or that the courts have come up with this. How do you explain it?
There is really no explanation. Um, at the first, when this began in 2019, there was no policy put in place. I remember when they first approached me, the transplant doctors I'm speaking about, they called me and told me they would have to make a decision on the vaccines because there was no policy or anything written at that time. So I waited for quite a while, probably a month or more, and they finally get back to me and they said, well, I guess we're going to have to get anybody that needs a transplant, they will have to take the COVID-19 vaccine. So it wasn't a policy that was put in place. It was decided around a table with a bunch of doctors, and they decided in Alberta that it would be necessary for us to have anybody that needed the transplant to have a vaccine prior to being transplanted. And the policy was then written. I've never seen it. Excuse me. I've asked twice for it. Last June, 2021, I asked for the written COVID policy because I've never seen it. And I asked again 3 weeks ago for the same policy, which I haven't heard back from yet from the doctors. So for some reason, they don't want to show me the written COVID-19 policy, which was supposed to be finished in April of 2022 anyway. And that's why I wanted to see it. Because if there was a written policy in the first place, that's saying if there was, then it's finished. It was finished in April 2022. So that's what's standing between me and the transplant, is this written a hospital policy. It's not a government policy, it's a provincial policy.
Yeah, let's have a look at the release here. This is from the Justice Center for Constitutional Freedoms. Alberta, the Justice Center is disappointed that the Alberta Court of Appeal decided that the Canadian Charter of Rights and Freedoms does not apply to Alberta Health Services and Alberta transplant doctors' COVID-19 vaccine policy for transplant candidate Sheila Annette Lewis, challenged AHS, Alberta Health Services, and her transplant doctors' COVID-19's vaccine policy, which required her to receive the COVID-19 vaccine before she could receive a life-saving transplant. What's your next move, Sheila?
Well, the JCCF has offered to take it to the Supreme Court of Canada. So that's the next move. They're in the process of doing that. So hopefully it makes it there. Hopefully I live long enough to see it. It takes quite a while to go to the Supreme Court. I don't have time on my side, unfortunately. Yeah, so I hope to be able to see that.
Yeah, exactly. So time is running out, and
Yeah.
presumably these cynical judges will drag their heels and probably hope that they never have to make this ruling and decision in your case. It's an absolute outrage. And
Although
good
that's
for
the
you
worst
for
about the Supreme Court. Supreme Court can't only take so many cases a year, and it's all in one hand what you can count of cases. I think it's 4. So it doesn't mean they're even going to take my case.
Have you
And
spoken with the government? Have you spoken with Premier Smith or any of her
no,
officials?
unfortunately not yet. I'm hoping to. She said she was going to look into it. I have hope that she does, and I hope they come to the decision that it's wrong, because not everybody can take these vaccines, and the doctors know that. Like, I had two doctors that studied vaccine for a living. They've done it for over 35 years, and they testified in court, both of them. And I mean, they make vaccines for a living. They know what they're talking about. And there was 2 that testified on my behalf in court under oath, said that I could not take this vaccine. It would do me more harm than good, because it's the mRNA spike protein that's in the mRNA spike protein that's in the vaccine. That's what will harm me. and it will travel to the organ that I need, and it will do a lot more harm.
And it's like they're telling you to pick your poison. Either you can take the shots, or you can, they
Or
can
I
wait you
die.
out. Yeah, or you can die. It's like
I just
they're
wanted to
asking you. It's. Did you want to pipe in? Do you want to get something in, Andy?
I just wanted to point out, yeah, and I believe that this was in the JCCF press release, is that Sheila isn't against all vaccinations, like your 4 childhood vaccinations, in our standard routine immunization schedule that we receive. It's just this particular vaccination that, she's not willing to receive for this transplant, and that, she's been advised apparently against receiving before getting the transplant. So, she's not a complete anti-vaxxer, right? She believes in routine immunizations. So it's just this vaccine that she takes issue with.
Yes, I retook all my childhood vaccinations
Yeah.
because the transplant team asked me to retake them all, which I did. So, yeah, I took them all over again like 2 years ago now. So I definitely am not an anti-vax.
Yeah, so huge problems here, and I mean, this is why I think a lot of people don't realize that this is still going on in our country. So it's so important to keep the spotlight on these things. And the other thing is that this policy could be changed on a whim at any time. I'm double vaccinated, but at any point in time, somebody could say, I'm not willing at this point to get my booster shot because I'm not sure about the benefit personally for myself. I'm in fairly good health and things like that. But at any time, somebody could change that policy and say, no, you need to get boosted to receive healthcare, or a certain type of healthcare that you might need, right? So again, it's one of those things where it's a slippery slope where we're going to start denying people cancer treatments and things like that unless they have their vaccination schedule or up to date, as far as, their doctors are concerned. And again, this isn't it's not a government policy. This is a policy that was made up by a particular set of doctors.
Yeah.
And we're not allowed to name those doctors under this publication ban, unfortunately. So I think that we have to help Sheila sort of continue to get the word out there, and we have to help her continue to fight this fight, right?
Yeah, absolutely. And to your credit, Sheila, you continue to fight. You continue to raise the issue, and you've got a website up, financial support for
Yes.
Sheila Annette Lewis, and we've got it up on the screen. Talk a little bit about your efforts in this fight to save your own life.
Pardon me?
Talk a little bit about your website and your campaign, please.
Okay. How this website came about and the campaign. A lady that actually heard my story on a news program. Her and her husband was watching it one night, and they seen my story, and she reached out through Messenger, and she inboxed me and asked me, a bunch of questions, and she couldn't believe it, and she just a lot of prayers and hope for me and for my future, and through talk, and she asked me, do I have disability? I said, no, I don't have it yet, but I'm still fighting for it. So she said, and just asked.
All right, I think we've lost your audio, Sheila, unfortunately, but we do have your website up, and it's a Give, Send, Go campaign, financial support for Sheila Annette Lewis. She's hoping to raise $10,000, really just beginning that process. So you can go to financial support for Sheila Annette Lewis and help her out if you can, if that's what you decide to do. Andy, did you want to say something?
Oh, I was going to say, I think that part of this funding and the goal is to also help her fight her court case, should she be able to make it to the Supreme Court of Canada. The JCCF, I read the other day, has had to downsize. They're having to let go some of their teams because as some of their cases are winding up, their financial support has been dwindling as well. So, and we know that fighting these court cases are exhausting. It takes a massive legal team. It takes a lot of experts to put these cases together, and it's very, very time consuming. It's very, very expensive to do these cases.
This Give, Send, Go is not for the lawyers, so I just want to make that
Okay.
because the JCCF do their own funding, and they do their own they get funded from donations. They do. They have for years. So,
are you getting support from family, friends, and people in your community, Sheila?
No, because I really don't get out, and I don't really know anybody at all. I've been in the house so long now. I don't see anybody, and I don't really know anybody in Alberta. I'm not from Alberta. I'm originally from the East Coast. So originally, I'm not, even though I look at Alberta as my home, of course, I've been here for 10 years now. So, yeah, so I don't know a lot of people in the profession I used to be in. I used to clean homes. And so it wasn't a place where you met a lot of people because there were empty homes you were cleaning. So I didn't get a chance to meet a lot of people out here. So,
Well, but this is a campaign that should interest everybody, not just in Alberta, but everybody across the country. And this is we're talking about bodily autonomy. Ultimately, it's
yeah,
your body, your choice, right?
pretty
You
much,
decide
yeah.
you don't want to get the shots. Well, you still need a transplant. Why do you have to get shots in order to get the transplant? And this is an absolutely outrageous decision by the courts. And as far as I could tell, it's based on the scarcity of the ability to provide service for everyone. I mean, this is what the other thing is that I found perplexing is the pretext and the reason why the court felt that this was justifiable under the circumstances. Andy, can you talk a little bit on that?
Yeah, I mean, well, they both pulled up a lot of experts. Like Sheila said, she brought her own experts in, right? And uh, let me just get the JCCF finding
I mean, they talk about
up here.
the need to provide health care and the need to have the service available to as many people as possible. And they seem to point to the fact that under the circumstances, we have to do this. I mean, it
So,
seems like a bizarre pretext for this. Sheila, what did
so
you think?
Well, we never had to get a vaccine before for anything, for any kind of a surgery. We never ever in life had to get, a vaccine to save your own life. And the other thing is, they're so scared of the COVID. I don't have COVID. So what are they afraid of? Like if I was going into a hospital to get a
Yeah,
transplant, I don't have COVID.
yeah, that's a
So
good point.
what is it
You've
that they're
tested
scared of?
negative, right? And so you
Yeah,
have no
exactly.
problem with getting another test, right?
No. The thing is, they won't even test me for natural immunity. I've asked them twice to test me for natural immunities, and they come back last year, and when I asked them, and they said, "No, we don't do that anymore." I said, "What do you mean you don't do that anymore?" They said, "No, we stopped that. We don't do it anymore." The transplant team said, and I
Sheila
said, "So
Annette Lewis.
you're not
Sheila
going to
Annette
test me for
Lewis.
natural immunity?" And they said, "Well, no, but we'll look into it for you." But they never get back to me. And then 3 weeks ago, when I was on a Zoom with them, I asked them again to get tested for natural immunity. And they said, "No, if you do that, you have to do it yourself. You have to go through Dying to Life in Alberta and get tested yourself if you want to do it." They know I can't get outside my home. I can't leave my house because my oxygen levels dropped so bad. I can't leave my house.
What a horrible thing.
And they know that.
yeah,
Sheila Annette Lewis joining us on Saga 960, along with Andy Lee on this Monday edition of the Mark Petronis Show. Andy, did you want to pipe in?
I did. Yeah. So I just wanted to read the ruling by Justice
Thank
Belzo
you. Yeah, go ahead.
from the Alberta Court of Appeal. So he said the only thing that really matters is the exercise of clinical judgment by the treating physicians. So he's basically said, I don't care about your medical evidence. I don't care about your experts. The only thing that matters in your case to me is the judgment of these four doctors that have created this policy that, there's a lot of gray area about that, Sheila says that she doesn't get to see. And he's saying that the only thing that matters is their own personal opinion. So basically, the judge has said the science doesn't matter. Your personal opinion matters. And I mean, we do have to rely on doctors somewhat for their expertise and their own personal opinion, but this is a huge case. So for them to say that that was the only thing that matters to this justice in this ruling is a little bit appalling, I think. I think that we have to weigh a lot of factors here, especially when we're creating, a ruling that might set a precedent for people down the road. So I thought that was really, really a disappointing part of the ruling. Personally, right? Like that's not how I expect my justice system to work in a case that has ramifications such as this, where this woman is looking at losing her life. Because of not getting an organ transplant. And again, the thing is that there's no clear evidence saying that if she gets the vaccine, her outcomes are definitely going to be better. right? Or that she definitely won't get COVID, and that might not, again, when you have like, somebody who has a liver transplant and they're an alcoholic, you know that if they don't stop drinking, they will ruin their liver. That's a definite outcome, right? That's going to happen. That's a repercussion of alcoholic liver disease. So that's sort of what they're basing this on, is standards like that. But again, there's no definitive thing that says that if she gets the COVID vaccine, her outcome is going to be better as a transplant patient,
Yeah, I
right?
want to read part of the story in the Edmonton Journal. In July, Court of King's Bench Justice Paul Belzil sided with the AHS, dismissing Lewis's application and concluding that medical chaos would ensure if doctors' clinical decisions were subject to charter scrutiny. That's the way I read it. Was, well, you can't just have everybody deciding for themselves what they want to do. Belzil also said there's overwhelming evidence that COVID vaccines are safe and effective, but stressed his decision did not hinge on that issue. Well, if it didn't hinge on that issue, why is he sticking it in there? I mean, and the science is constantly evolving. It's not like everybody's already just, yeah, we've had politicians come out and say, it's safe and effective, safe and effective. That's all they ever say. Well, we're finding out over time that maybe it's not so safe. And maybe it takes time to figure that out because, of course, we're all lab rats, at least anybody who opted to get these shots. I'm sorry, but this is absolutely outrageous.
Well, the thing is, too, if it's so safe and effective, how did they know right from the get-go it was safe and effective? I mean, right from day one, they kept saying safe and effective. They told me that themselves, the doctors. Well, how do you know? There was no data on it. An experimental, brand new vaccine, never been put out. How did they know it was safe and effective? I mean, we're putting this in our bodies, and we can't take it out once it's put in there. So how is it safe and effective? How do you claim that when there's no data, no long-term data, no nothing on it?
Yeah,
it doesn't make sense.
We're the guinea pigs.
Yeah.
Anybody who opted to get these shots ultimately has opted to become the lab rats to see what the long-term effect is, because it takes between 10 and 15 years, and it has in the past, to test these out, find out whether or not they're effective and safe. Here, boom, COVID comes out and this vaccine. Oh, here we go. We've got one here standing by. Well, excuse me, but that seems pretty fishy to me. But here we have a life and death case with Sheila Annette Lewis. Andy, good for you for raising this the profile of this story. And you're going to continue to do so, right?
Yeah, I'm going to do my best to help. I'm glad that, we connected, Sheila, and I'm going to do my best to keep on this. I don't know how much time Sheila's got left yet to fight this battle, though. But yeah, this has been in independent media a lot, right? This story and in MSM a little bit as well, too. It's just sort of like, is there anything that we can do to help, boost this process in the meantime while she's waiting for, the Supreme Court? So, what we can do is support her, right? Keep this in the news, try to keep the pressure on, write to your MPs if this outrages you, let them know. And of course, reach out to Danielle Smith if you can. She's wonderful. It is unusual for her to take on, somebody's personal medical health, but she has tried to the best of her ability. And I do believe that it is her intention to pursue this.
This is a fight. This is a hill to die on. Really, at the end of the day, no precedent, right? And so this would be a precedent-setting matter. So this is something that Albertans and everybody across the country needs to take on, because if it happens to Sheila, then presumably courts in the future are going to be able to use the same pretext to apply it going forward. Correct?
They could apply it to different things too, right? They couldn't just apply it to COVID vaccines. Like I said, this is sort of the slippery slope, right? So it's like, where do we decide that we're not going to provide life-saving care under what circumstances? And is this going to be an arbitrary decision, made up by individual doctors based on their personal experience, rather than, the sort of the whole picture? So, it's a dangerous place. And like I said, it's not just, you may say that this is just affecting Sheila. This could affect you down the road. If you're like me and you're kind of on the fence about boosters, We're seeing new studies coming out about boosters. I just put one out showing that the new variants that are circulating are causing 72% of the new infections in the United States right now. And the bivalent boosters are completely ineffective against these. But yet they're still saying go out and get boosted. Well, I mean, I'm sorry, why? If most of the new infections are, caused by different variants,
Yeah,
that
and if it was so effective, why would they be pushing these things to be updated now every 3 months? Right?
so
I mean,
at any
remember that? Remember, it was get your shot, get a booster, and that's it. You're safe, you're protected, because it's safe and effective. So don't worry about it. Just get the two. Now, then all of a sudden, well, you got to get a booster, another booster rather. And now it's like, well, if you hear, the health minister, the federal health minister, you got to get updated. You're like a piece of software now. And every 3 months, 90 days, come in and get yet another shot. It never ends. See, those protocols have constantly been changing. So the idea that somehow you can cite the science to insist that the people take these because they're safe and effective is bogus on the face of it. Because the government's advice to the people has been changing and evolving over time, hasn't it, Sheila?
Yes, it certainly has. Certainly has. It's a funny thing too. You know, they're caught so many times not wearing their masks or whatever, and they do an exact opposite what they're telling us to do. They're telling us to get these vaccines, wear the mask, safe distancing, you know, stay home or whatever. But you know, they don't seem to be doing the same thing they're telling us to do. You know, they lock us down, they do whatever, but there's nothing safe about any of this. And I just don't get why they're doing. Well, I get why they're doing it, but it's doing a lot of damage to a lot of people. And there's a lot more people out there, other than just me, that's fighting this fight. There's a lot of people across Canada, United States, everywhere that's in the same boat. And for the love of God, I believe in the higher power, and I believe there's going to come a time where He's going to intervene, and He will take out this evil. And I hope He does, because evil is what's on this earth.
Well, this is evil. Bunch of judges deciding that you have to get shots that you don't want, that you feel are going to hurt you in order to get a transplant. I mean, you've worked hard all your life, Sheila. You paid taxes, have you not? Haven't you been paying into the healthcare system? Has the government been taking money out of your pay every couple of weeks or however often you get paid? Lord knows.
Well, not for a long time. I haven't had any.
Well, yeah, because you've been sick.
But yes, I used to. Yeah.
For decades, the government has been. You've been paying taxes so you can put money into the system, right? That's the way it's supposed to work.
Paid all my life. All my working life.
Well, you've had no choice.
Yeah.
You haven't had a choice to opt out of the healthcare system. You got to pay. In Canada, that's the way it works. You don't get to pay for health insurance instead of this. The government's going to take your money because that's the way it works. That's socialized healthcare. Government takes your money, gives you the healthcare, and say that's the way it works. But now there's strings attached, isn't there? Now they're saying, well, yeah, sure, you get healthcare. Yeah, you paid your money into it all this time, but now you got to get the shots. Why? Because Big Pharma is calling the shots. That's why.
I did want to ask a question along those lines.
Go ahead.
Sheila, I'm just wondering, have you investigated care outside of Canada and the cost of a transplant outside of Canada?
Yes,
have you considered private fundraising to fund that expenditure?
Well, it costs a lot of money.
Yeah, but there's a lot of generous people out there.
Yeah.
There's a lot. You'd be amazed at people's generosity. I've definitely been amazed myself. And like I said, a lot of my supporters have offered me money, which I've always turned down. But I know that there's very good people out there who would maybe have a vested interest and be willing to fund something. So I'm just curious if that's an avenue that you've explored, or maybe something that we could look at in the future.
Yeah, I know there's at least one place in the United States that does it. And I've looked into it. Jacksonville, Florida is one of them, possibly, but they'd have to see the records or whatever. And other than that, there's a lot of things up in the air right now, but I'm not saying, excuse me, that I haven't looked into it or thought of it, because I did. I mean, anything to save your life, right? You're going to do what it takes to save your own life. And it's it's a short hill I got left.
Well,
And
like I said, I wouldn't count out the possibility that you could fundraise the funds to get a private organ transplant
it would
done
be a miracle.
out of country. Well, you know what? People never thought the truckers were going to raise $10 million, and we did it
So,
twice, right?
that
So
was beautiful.
there's a lot of support behind these sort of movements, and there's a lot of compassion out there. And I know that our fellow Canadians and a lot of our Americans are, very, very wonderful people who are donating to causes like this. So I think that, if you're comfortable with that, I would explore that further, and I wouldn't count it out as a possibility. I know that it was, you obviously had a lot of, riding on this ruling, and this is a new ruling, relatively new, right? And of course, you were hoping to be successful in your appeal. So, maybe now the time has come to look at other avenues now that we know that, your second case has been shot down.
Well, the thing is with my courts, the two court trials that I had, I was devastated, to say the least. I couldn't believe that that there was a court judge that would actually deny, something that is so cynical. Because like a vaccine, it was my choice to put it in my body or not to. But it's not that; it was the evidence that we gave to the courts, and they just dismissed it. The evidence was all there. How it was dangerous for me to take this, this vaccine, and possibly a really good chance of harming the organ that I need to be replaced already. It's already that damaged, and this vaccine would have done a lot of harm. So for the judges to deny that and just take that evidence and just throw it away or not even look at it, it devastated me. So then when we appealed it, I really had a lot of hope with the appeal board. They had 3 judges on their panel, and I really prayed that they would overturn
And yet they
overturn
didn't.
the policy.
Well, it's the
'Cause
holiday
it's
season, and
yeah,
you want to feel good. You want to do something for a fellow human being who's facing the end of her life. This is an opportunity. Give us the coordinates where people can donate if they want, Sheila.
pardon me.
Give us the coordinates, givesango.com. Financial support for Sheila Annette Lewis, right?
Yeah, yeah.
Okay, perfect. Well, listen,
Sorry, I
thank you.
just
That's okay.
It's
That's all
okay.
right.
Hey, this is your life, Sheila. This isn't, this isn't
Yeah,
a joke. I
yeah.
mean, none of this is a joke, right? This is really, really serious business. This is a life or death situation for you. And you're being discriminated against because you've decided not to take a vaccine, not just, not particular vaccine you take issue with. So, and like I said, this is not, people might think isn't going to affect me down the road. Well, this absolutely could affect you down the road. That's why it's so important that we don't let things like this slide. And, we keep fighting these cases and things like that. Because at any time, if a couple of doctors can get together and say arbitrarily that they know best, and they can change the parameters upon which they, deliver your medical care, that's a pretty dangerous place to go. I certainly don't like it, right?
Absolutely.
And I don't think anybody likes
I can
that.
tell you, if this was a high-profile politician or some powerful
yeah,
individual, this would not be happening. This
no,
happens to little people. This
yeah,
happens
the
to
working
people,
class, yeah,
yeah,
the
people
middle class people,
who don't have millions of dollars. Yeah.
exactly.
Would this be happening to a member of parliament? I don't believe it. Don't believe it for a
No,
second.
never in a million years. I really believe that. Yeah, I think the hardest part of all this for me is my grandkids. They're so
Yeah.
little, and I always wanted to be able to raise my grandkids and and see them bloom and go through
Of course you
schools
do.
and but when I think of them and they're so little, they're only 5 and 6, or sorry, they're 6, 1, 7 now. Um, they don't get to choose. They don't get to see Nana when they want to. If anything happens to me, like where's the fairness in that?
Yeah,
Like
and when
it's more
you
than
go back
just
to how elderly people were treated during the lockdowns,
yeah, exactly.
it's amazing the cruelty, how cruel governments have become, like maniacally sick,
Greed and
sick.
power.
There's
Shame
been,
on these people.
I was going
Really
to
pisses me off.
Mark, I found today there was an article on 2 new studies put out about lockdowns and how, we did all these things and we were told that we were saving people's lives. But now there's research studies coming out saying that preventing grandparents from seeing their grandchildren may have resulted actually in, worse severe outcomes for them if they contracted COVID down the road because they weren't routinely exposed to the common cold and viruses like that. So, we're learning now that we may have made a lot of mistakes. So this
I
is
don't
a
know. You could call it a mistake, but to me, there's something sociopathic about the people who made those decisions. There's something very, very wrong.
The thing is, why didn't
You
they
know,
push vitamin like D3 or vitamin C or all the vitamins that are good for our immune
yeah,
system?
it's bizarre.
Not
It's all of
one
a sudden, yeah,
doctor.
they don't want to talk about
No.
taking vitamin D3. We've seen there's been studies, there's peer-reviewed studies going back years that we need this substance in our body. These
Yeah.
are necessities. Vitamin C. People have been taking vitamin C since the days of
None of the
scurvy
doctors
on
have told
ships.
me I should.
But
It's true.
anyway, thank you, Sheila. I do appreciate that, and all I can say is, we're behind you 100%. Thank you so much for coming out and talking about this.
Thank you for having me on your show. I appreciate it.
All right,
Yeah,
And
sure.
Merry
Andy. Thank you,
Christmas to
Andy,
everybody.
as well.
Yeah, thank you
Appreciate you
I'm glad that we
bringing this story
connected.
and making people aware of it. Good for you.
I'm glad we connected. Hopefully your fundraiser gets some hits. If you can, if you have a little bit to give this Christmas season, maybe you've offered to give me something and I've turned you down. Maybe consider donating that to Sheila. That would mean a lot to me. Because, and like I said, this might just be affecting her right now, but it could affect any of you one day.
Exactly.
Right?
Thank you, Andy. Thank you.
Yeah, it's good to see you again, Mark.
Nice
And
to see you.
we'll follow up with this.
Thank you. We absolutely will.
Merry
Bye-bye.
Christmas.
Merry Christmas. Yeah, absolutely. Hopefully we'll do it again in the next week or two, even before. Thank you. All right, let's take a break, my friends. Back with more News Talk Saga 960 and the Mark Petrona Show after this.